Have you heard about FDA-approved Vyvgart Hytrulo, efgartigimod alpha, and hyaluronidase QVFC for subcutaneous injection? Visit VyvgartHCP.com to discover clinical trial data and explore patient profiles. Vyvgart is a registered trademark of argenx. Vyvgart Hytrulo is a trademark of argenx.
This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Stacey Clardy from the Salt Lake City VA and the University of Utah. Today I'm talking with our president-elect of the American Academy of Neurology, Natalia Rost. Natalia is professor of neurology at Harvard Medical School and the stroke division chief at Mass General, and also a very accomplished researcher in the stroke world as well. But today, we're going to have a discussion with Natalia about the AAN's Brain Health Initiative. She has been a leader in this effort since its inception, and the work going on with the Brain Health Initiative stands to benefit all of us, patients, researchers, and clinicians alike. So understanding what those opportunities are and getting a bit of an update on progress of the initiative is what we'll focus on today. Welcome, Natalia. Thank you for joining us.
Thank you for having me.
So about the Brain Health Initiative, sounds very lofty, very fancy name, aspirational, practically speaking. Before we get into the specific components, what is the background of this Brain Health Initiative? Where did the idea for the initiative come from?
The Academy has been building the momentum in public education, engagement, and specifically brain health for decades. This was the intent of the Brain in Life magazine, which of course grew to a whole suite of public-facing offerings at the Academy. Of those brain health fairs, if you remember, that we brought with us wherever we went for our annual meetings before the pandemic, our bike helmet giveaways that we had at the Academy headquarters, and many other activities and efforts. But what became clear, and especially with the pandemic impact, is that there's an explosion of knowledge in all areas of health, but especially as related to brain health. And with that, there is a growth in public curiosity about brain health and the desire to live healthier lives, really, to be proactive about longevity, also quality of life. And a lot of it tied so closely to our mental health and optimal cognitive function and physical performance and just overall well-being. And with that evolution of brain health awareness, we as neurologists all agree that we have to have a responsibility, and this responsibility is really growing to be the trusted source of information on quote-unquote all things brain, and to be the advocates for those whose brains are vulnerable to disease, but also to be the champions for the type of change that pushes our current understanding of what's possible, and to offer a vision for the future where everybody has a chance at optimal brain health. And it's that vision that we communicated in the AAN Statement of Position and the Call to Action on Brain Health, which was published in September of 2023 in Neurology, at the foundation of the AAN's Brain Health Initiative, which by now has touched every aspect of the Academy's work, and it has been transformative in a true meaning of the word. And as the AAN revealed its new 5-year strategic plan earlier this year, and with a new mission statement, which now reads to enhance member career fulfillment and promote brain health for all.
I hear you saying it's a moment in time. It's the culmination of a lot of things, a lot of pieces that have been going on in separate areas. You gave examples of different smaller scope individual things the AAN's been doing and other groups have been doing. Am I hearing you correctly?
For sure. I think that this is a culmination, but it's also something that's very intrinsic to our work as neurologists. I've said it often, and I'll say it again. We as neurologists are custodians of the brain, right? We are trained to do this work. We are trained to take care of the brains with disease, but what about the concept of preventing then disease? What about the future where we need to focus on enhancing capabilities of the brain rather than dealing with nitty-gritty of neuropathological diagnosis? So I think this is where it's all coming to, this kind of a concept and the yearning to make a difference and to move in a structured and strategic way.
Yeah, I agree. And prevention is really something that maybe historically 20, 30, 40 years ago, we didn't talk about as much. And it's such an important part of making the next leap in neurology and in overall lifespan health. I think I am getting the message here. And before we get into the specific components, I think there's 4 specific components. What is the overall goal in terms of how it's going to impact us as neurologists? What am I going to see in the coming months and years that I'm going to know is born out of the Brain Health Initiative?
It's very simple. The overall goal is to ensure that brain health is a key aspect of public engagement through the Academy, and to position the AAN and neurologists as champions of brain health in collaboration, of course, with a broad range of other brain health providers. We are well positioned to serve as the conveners in a very broad and often diffuse world of brain health. Sometimes it's unfocused because there are some cases like non-traditional approaches to well-being, or perhaps hyper-focused through the lens of other professional organizations that are interested in spotlighting the angle of brain health that they're in charge of, like mental health or vascular health or cognitive. But we as neurologists have the responsibility to bring all of these players or stakeholders in brain health into the same room and work together to make sure that we harness this complex and impactful concept for the benefit of our patients with brain disorders, for the public in general, because public has the right of access to all the resources that we may have for them to improve the quality and optimize the function of their brain. And now that we have this framework through which we can approach this enormous issue, the AAN's action plan across individual lifespan, that allows us to bring the experts to focus on the very specific brain health goals during the different life stages, but also identify lifelong needs. And this is really what we are already doing. We've had our inaugural brain health summits. We've had our position and a platform published. I've identified the pillars of the initiative. And now it's just a bit of a marathon that we have to all complete before we get to the national brain health vision that the Academy proposed by 2050.
Understood. And it's actually a great reminder. We know as practicing neurologists that we do serve as a central point to access and process for not just our patients, but our friends in the neighborhood and everyone in our communities, the broad array of information from the basic science all the way to the commercial that's seen on TV. But this is a great reminder, the way you're framing this, neurologists are uniquely positioned to do this. And so with that background, can you outline for us what are the 4 major components or pillars that we need to be aware of in how this is being organized?
The pillars concept comes from the AAN Brain Health platform, which included our positions on brain health, our 3 ambitious goals. Those are the goals that akin to the cancer moonshot, since we believe the AAN Brain Health Initiative is just as instrumental in breaking the sound barrier on what the future of health may look like for all of us, and the AAN's National Brain Health Vision for 2050. And all of these are published and available open access in neurology, but the pillars themselves help us organize our work around them. So number 1, science. Because as a clinician scientist myself, I believe that everything begins and ends with science, really. And we believe in accelerating research and discovery to achieve scientific breakthroughs in prevention of neurological conditions. We have a plethora of knowledge regarding neurological disease right now. How do we take that knowledge that already exists and bring it from out of the silos and put it under the microscope or put it under the spotlight somehow to examine what are the critical components that help us identify not only the scientific concepts that contribute to neurological disease, but also to the brain health itself. So that's one of the very important issues to focus on. Number 2, patient care, because everything that we do is at the core of why we're doing this, why this entire effort is necessary, is our patients and our future patients, for whom hopefully we'll be able to prevent some of the disastrous outcomes of neurological disease or brain diseases. So we believe that patient care begins with providing trustworthy brain health resources and information to medical professionals at all stages of training. So not only being a trustworthy source of information to the public, but also making sure that we deliver validated and quality checked information to all of our medical professionals, both neurologists and non-neurologists, because as you were saying earlier, even though we are the hub of information on brain health, and should be the hub of that information, we cannot do it alone as neurologists. We need to engage all sorts of doctors across the entire individual lifespan, from pediatricians and even OBGYNs while the brains are being developed and the babies are being born and in critical phases of development. We all need to kind of work together to promote the brain health as a whole, but neurologists should be championing this process. Pillar number 3 is public policy. This is the AAN's strength. We're very strong in advocacy. That's my shout out for the Brain Pack. Please support Brain Pack. We can do a lot if we can move the needle on public policy. And we believe that advancing brain health by working with policymakers on the federal and state levels will help us get to where we need to be. And number 4 is public education. Engaging with the public about how to keep your brain healthy throughout every stage of life is something that we are already doing, but we need to be much more deliberate, and we need to be everywhere. We need to be in kindergartens. We need to be in schools. We need to be in communities and barbershops. We need to be everywhere where the gospel of brain health can be told.
Wow, this is great and comprehensive. And now that you have me motivated, how can I participate?
You're doing it right now, actually. So one way for every member within the Academy to participate is to figure out what's really a passion for you, whether it's education, whether it's advocacy, whether it's science, whether it's patient care, quality products. There is role for everybody and for everyone. And I actually think that this focus on brain health is going to be really a motivator for others who are maybe not neurologists right now, but they want to be practicing in some sort of a realm of preventive neurology, maybe even through some of the future certified brain health fellowships or something like that. Maybe they'll be working cross specialties in collaborating and contributing to our membership growth and overall member career fulfillment. I want to say that we already made some difference, and you already probably participated in some of these sessions at the annual meeting in Denver, where brain health was everywhere. If you were at the Hot Topics plenary on day 1, there was a new session focused on brain health. If you were at the presidential plenary, there was an interview with Sanjay Gupta talking about brain health as a concept, and his important take as an expert in public engagement was a very unique angle that we were able to bring in. The Innovation Hub hosted conversation about brain health and neurology practices today and tomorrow. We had a global brain health conversation with the presidents of major neurological associations. As you can tell, that there's brain health activities everywhere and touch every aspect of work. If you are a young researcher, we have the Sacco Fellowships. Ralph Sacco was a great champion of brain health, and we had the fellowship application cycle open. Currently, the applications are under review. We hope to have our first Sacco scholars named in the next few weeks or so. So, plethora of activities. Everybody can get a chance to get involved, and we will need so much help along every line of work within the Brain Health Initiative and every angle of interface between brain health and neurology practice today in the future. So we welcome everybody. Let us know what you're interested in, where your passions are. Join in and let's do it together.
Now, this is a large and long-term initiative. Have you encountered any challenges so far, or do you anticipate that there are any challenges coming down the road? Tell us how it's been going so far.
The obvious challenge is the enormity of the field. And so we had to be very deliberate over the past several years in setting the milestones and delivering consistently along the way. For example, the Brain Health Summit planning, which includes identifying the internal to the Academy and external stakeholders in brain health, and then working closely on growing our AAN-led brain health coalition in that space. The brain health definition, for example, the development process involved multiple iterations, involvement from multiple members of the Academy and experts in life stages and brain health. So that was quite an important process, but we made sure that we were very systematic in how we set it up and then ultimately delivered it for the position statement. Our brain health platform and action plan gathering again the experts across the lifespan, focusing on identifying critical gaps in research, patient care, education, and direct-to-public communication, summarizing all of that, identifying those gaps that are rising to the critical priority and opening up the conversation to the world. That was an important challenge that we've worked through and were able to deliver. And the latest is that the AAN's board of directors approved 7 specific programs that align with our platform and are guided by our pillars. And this program development is where we have now been focused with the Brain Health Committee and the way it aligns with the AAN's 5-year strategic plans. I would definitely recommend staying tuned on the developments. We envision that our annual Brain Health Summit will be the forum which allows us to check in, so to speak, with the regular deliverables, but we are also guided by this 5-year strategic plan structure. And of course, our 2050 brain health vision on the horizon. And believe it or not, we will get there sooner than we can imagine. So there's really no time to rest on our laurels.
I'm going to have to take some notes of things to check back on. I can't wait to see who the inaugural Brain Health Fellows are and all of these initiatives you're working on. Tell us when we're going to hear more and how to find out information about them.
I would say stay tuned. We are going to have our 3rd Brain Health Summit in September of this year. It's going to happen in Washington, D.C., which we feel is an important venue for us to bring all the stakeholders together. It also rises to the occasion whereas AAN is very strong on public policy. And so we have an opportunity to engage not just professional organizations and academics, but also the governmental officials who are important to our process.
Okay, now that I have a sense of where this is, where it's going, the vision, what else do I need to know? And where do I go to get updates on all of this?
First of all, it's important to highlight that the Brain Health Initiative now has an official landing page on our Academy's website. So it's www.aan.com/brainhealth. And it also could be found under resources. And this is where we envision the hub of the AAN Brain Health Initiative with all the resources and tools will be concentrated. For those who had not yet explored that page, please take a look and let us know what you think. And also, I wanted to ask our members whether they noted that our AAN logo now has a tagline, Brain Health for All. If you haven't noticed that, please take a look. This is how serious we are at the Academy about brain health.
Wow, well, that's fantastic. I did notice that, but I have not yet been to the webpage, so I am going to go and check it out. And it sounds like a lot of updates to come in the coming months as well on that webpage. So maybe bookmark that and I'll go back and check it. Natalia, it has been really refreshing to hear about this. I love knowing that there is a ton of energy and thought being put into the future instead of just the day-to-day, the month-to-month. This is a really tremendous initiative, and I'm excited because it has deliverables. I think I'm going to be able to see the fruits of this in the short term and know that it's building toward the longer term and things I can't imagine. So what a fun time and a great chat, stepping back from the daily grind and looking at the field. And I can't wait to keep hearing more about this. And especially as you enter your time at the helm of the AAN over the next couple of years, thank you again for taking the time to discuss this and for putting clearly so much energy into it. We appreciate it.
It's a pleasure.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.